Hello, Alexandra and my discussion group. I'm really looking forward to this discussion. I think, Alexandra, that I think you did a really excellent job on synthesizing and communicating the primary points of the article that you chose. And I think overall, I really agree with the conclusions that you drew, especially talking about like some of the controversies as well. Um, I really think this is an excellent article to choose for the topic of epidemiology, specifically because it's getting at a lot of this causality component, and that's like this big point in the article. I found myself a little bit inclined in this instance to agree with the DOH lady in that if we as scientists are going to swear before court and even just claim that this is the smoking gun, sort of this like causal link, that it really needs to stack up evidence-wise. So I have a couple thoughts and a couple questions. One, I'm really curious what my peers, what you all think about the scientific communication here. So scientific communication is something I find really fascinating. How do we communicate evidence to the public without misrepresenting the evidence or like boiling it down to like a point that can be taken and sort of run with, and being really careful about that. So I'm curious, do you think that the article, the news article and also the original research article too strongly imply causation? Do you think that they actually have the basis for making that claim? I'm really interested in how you all see like the loyalties of the individual epidemiologists in this case, how their loyalties to these different groups and organizations might influence the claims that they're making as well. Then just from like my own research interest area, I'm curious kind of connecting this with some of the other topics that we've talked about in the course so far. I'm really curious about the evidence of the potential for pregnancy being a critical developmental period, and the effects of PFASs on gestation specifically. So I was really excited that you chose this article because it does focus on this developmental period of pregnancy. I also think the original authors could have potentially done a better job of evaluating causality. So at the end of the article, the Tribune mentions a meta-analysis, and I think that I found that article. So I'm going to include the reference in my post. But it is a meta-analysis of 24 studies looking specifically at PFOA, which is one of the two more common types of PFASs. And they conclude, the authors conclude, that there was only a modest support for decreased birth weight with increasing PFOA in mothers during pregnancy. And they found that with blood sampled early on in pregnancy, that it showed little or no association of PFOA with birth weight. And they also specifically mentioned that in these studies, they control and there's a little room for confounding variables and different things. And I just think that birth weight and premature birth and things like that is such a complex issue, and there are other factors that would need to be controlled in order to say that the PFAS chemicals in the water were actually leading to birth weight. Low birth weight would be things, I mean, something like smoking, for example. Like if mothers smoke, that's a huge predictor of low birth weight. So I'm really excited for the discussion around the causality issue, just like from an epidemiological perspective, and also the scientific communication piece, and what's communicated to the general audience and the community. So I'm looking forward to all of your feedback.